So welcome. I'm Leanne Mersman, the volunteer coordinator in Colorado, and today's volunteer mission rally is offered to Colorado volunteers to thank you for your outstanding work during COVID-19 isolation, give an update on few association activities, and connect you to additional resources. We will thank you for your time, and we'll let you know that this session is being recorded so we can share it with other volunteers. We invite you to ask questions using the chat throughout today's call, and we'll reserve time for Q&A at the end. First, I want to introduce Amelia Schaefer, the Executive Director of the Colorado chapter, to share with you our deepest appreciation for the ways our chapter continued to support our constituents nationwide.
Thank you, Leanne, and thank you. I love seeing so many familiar faces, names, and so I'm really happy to see all of you. Some of you have just been devoted to the Alzheimer's Association for so many years. Some of you are newer on our volunteer course, so just a big thank you to all of you for what you do. I did want to share with you a little bit about what has been happening at the Alzheimer's Association since March. Many of you are more aware of what's happening on a week-by-week basis, but I think it's important for you all to understand sort of where we've been, what we've learned, and sort of what we see coming for the future. So when COVID really became a reality, which for I think many of us, we can track it back to mid-March. For us, it was March 12th. I remember it very specifically. Some of you might as well. And we really learned in one day's time that we were going to need to move all of our operations to remote, 100% of what we were doing, including all of our service to families, all of our work with volunteers, and then all of the other work happening in our other pillars. And so, you know, I think that for all of us, we were really focused on how do we make sure we still are able to deliver our mission. That was, I think, at the forefront of everything we were thinking. And so I will tell you, it has been humbling and also just really amazing to watch how we were able to shift all of our operations nationwide to be virtual. And so just to give you a few details, many of you know we have a 24/7 helpline. Hopefully you all know that. Some of you have used it. We were able to get our 24/7 helpline completely moved to remote within 3 days, which to me is amazing because just from Colorado, we are taking, you know, anywhere between 500 and 600 calls every month. And so, you know, the fact that we were able to move everything nationwide virtual was just amazing. And then for many of you, I know you're involved in support groups. I heard Cynthia talking about her support group earlier, or you are community educators for us. Within a week, we were really looking at how do we shift all of our programming to either phone or live webinar delivery. And so I'm just amazed at what we were able to accomplish here in Colorado and really across the country for all of our families. Let me give you a couple of stats here. Since mid-March, we have delivered 5,393 support groups or webinars virtually, and that is nationwide. So over 5,000 support groups or education seminars virtually nationwide. And that led to us serving over 30,000 constituents out there who would not have had our help beforehand. And so for me, that's why we're all here. I mean, that is the mission, is what drives all of us. I know it's what drives you all as our volunteers as well. And, you know, I think that if you're like me, I'm ready to get back to normal. I want us to get back in those rooms with people. I want families to be able to get back to seeing the people they love who might be in assisted living. I want us to be gathering in our groups and seeing one another, but we are really committed, and I want you to hear this from me, that we are absolutely erring on the side of caution and safety nationwide. We have a vulnerable population. We care about you all as our volunteers, and we care about our staff. And so we will be erring on the side of caution. I know you've heard that, and I know it's frustrating because it is for us too. But we want you to know that we will continue to grow and evolve and learn new things until we can actually meet in person again. So I wanted to share with you a few of the interesting things that we've learned that some of you maybe have been a part of this or know this, but a few findings that we'll carry with us going forward. First of all, I think that when we looked at our programming and who we were serving, we were leaving some people out, and particularly rural communities and diverse communities weren't necessarily always well served by all of our in-person programming. And so for many of our rural communities, we've actually been doing a pilot program. And for many of our rural communities, we've actually seen an increase in the attendance at education programs. It's a slight increase, but an average of 8 people used to attend our in-person classes before out in rural areas. And now it's more like an average of 10. So I think that the better we become, the more equipped as a country we are at being able to engage with one another virtually. I think we may even see an increase there. We're also piloting some of our programming in diverse communities, and we've seen one webinar draw in hundreds of people. We've been able to record some of the webinars, which means people who couldn't make the first showing of it were able to watch it after, which they have really appreciated. And then I think it's also given people a bit of anonymity. They're able to join our programs without, signing up and saying, hey, I'm going to drive down to my local church and attend an Alzheimer's program, which can have some stigma, as many of you know. And so I think it allows a little of that anonymity, which is helpful in some rural communities and certainly in some diverse communities as well. And then I think of those caregivers at home, and I know some of you have been those caregivers, maybe you are working with those caregivers, but the fact that with COVID-19, many of us have been more isolated. And so I think providing care and support for those families in different ways is something we've been really working on. I think, as we said earlier, those families who have a loved one in assisted living or in a nursing home who aren't able to visit, they've needed a little extra listening ear. They've needed a place to vent. They've needed someone to talk with about how can I connect. And I think we've been there for them. You've been there for them, many of you, to help problem solve and talk through and just be that listening ear that they really need. And then for a lot of families, they've lost their respite options. So they are truly that 24/7 caregiver in the home now. And so we've had a lot of calls to our helpline that have been a little more complex, and people have a lot more going on, and they've taken a little longer. The calls are a little longer than they used to be because people need a place to get that out and to be able to talk. And so I'm really proud that our association has been able to continue delivering that mission, but I know we could not have done that without you all. Particularly here in Colorado, we are truly volunteer driven, volunteer powered, and you guys make such a difference to us. And I know many of you have had to adjust your calendars. You've had to learn a new thing or two with this virtual engagement, as well as all the rest of us have. We're still learning, still trying to figure out how to get my cat out of my screenshot sometimes. But I think the thing is, we are doing this together, and we are learning together, and we are helping people together. And that is really what matters the most. And so I want to say, I have the deepest appreciation for all of you. I'd love to give you all a virtual high five right now. I don't know if we've been able to figure out how to make that happen, but really just a big, big thank you. And I'm excited for you to hear the rest of sort of what's happening in our world at the association, and really excited to turn it over to my colleagues who are going to talk to you about Walk to End Alzheimer's. Some really, really cool things happening. Again, you can imagine, how do you do these events across our state when usually we gather in person? We have found some very creative and cool ways to do that, and we really need your help. I mean, you are our volunteers in all of the work we do are really our ambassadors out in the community. So can't wait for you to hear about some of the things happening. Hopefully you've signed up a team. Would love to see that if you haven't yet, but would love to have you learn more about it with my colleagues, Allie and Rebecca. So over to you guys.
Thank you, Amelia, and thanks to all of you who are on this call and who have been volunteering with us for whatever amount of time. We're so grateful for what you do. We have our committee, some of you might be on the committee, who help us plan the walk, and we could not do it without our volunteers in any way. So we're so appreciative of you. especially now when it's hard to do this work. So we're just so grateful you're here. And all of those programs and services Amelia just went through continue to be funded because of our walks and multiple programs or multiple fundraising sources, but our walks are our largest one. They're the ones that bring in the most funding so that we can continue to provide all of those program services for our families at no charge. And so some of you might be walkers and some of you might not be, and we're hoping we can bring you over to the walk world. And you might be wondering what we are doing this fall because of the way the world is. The walk to end Alzheimer's, you guys, it's happening. It's totally happening. It feels like everything's on hold, but we all know that the threat of Alzheimer's has not been on hold, that nothing's changed for that. And that's why this walk is happening everywhere. It's not just going to be in a specific spot this year. It can happen on any street. It can happen led by anyone. It's an event, and it's not just an event. It's a movement, and you guys either have or can join right now. We won't be gathering in our large walks this year, unfortunately, which you may have already thought about, because it's just not safe. And the last thing we want is to put any of you or any of your loved ones in a dangerous position because you wanted to attend the walk. So guess what? We are bringing the walk to you guys this year. We are going to make it possible for you to have your own walks in your own homes. Your local walk date will still be the date you walk. So keep that day, because we want you guys to celebrate on that day with your friends, with your family, with your teams. So what we're going to do is have an online platform, an interactive platform that you guys can engage with and watch the local kickoff ceremony and the promise flower ceremony on this platform. They'll have a countdown that we usually do on that day, and then everyone will sort of disperse and you guys will be able to walk safely in your own neighborhoods. You could also walk on a trail. You could also walk in a park. You could also go somewhere that's special for you and your loved ones and your families, and either celebrate or memorialize or whatever works for your family that day. That's what's really cool about this, you guys, is that it's a flexible kind of an event that allows you to celebrate, allows you to be together safely. And it'll start expanding the knowledge or the awareness of WALK and the Alzheimer's Association in your neighborhoods or your communities, because you can decorate your homes. You can put up signage if your HOA allows for that. You can put on your purple and march out in the streets and see what people have to say, wear your masks, be safe. We'll be sending you guys some ways that you can do those things, right? So you'll get your t-shirts, all of those. If you raise that $100 or more individually, we'll send those t-shirts to you this year. We will be mailing them. We will not be doing our big pickups or anything like that, but they will come to your home. So it is important that your t-shirt size and your address are updated if you're a registered participant. We will be sending yard signs out to those who have raised $500 or more and become champions. So you can put those up in your yard or carry them. Also, every person that registers will be receiving some symbolic flags that you can put up or carry, however you want to use them. This year, unfortunately, we're not going to be able to mail out our promise flowers because they're too delicate. They're kind of an awkward size. So the flags are going to be our symbolic item that you guys can carry. They do have a picture of the promise flowers on the back. They're purple and they say WALK. So get ready for your walk in your own community this year. Actually, an email just went out to all of our participants, our registered participants and past participants today that describes some of these things, and you guys can go ahead and get registered on that. We'll have a pep rally in August that we'll be sending out some more communication that you can jump on and learn more about what we're going to do this year. So stay tuned, and we're actually really excited about this, you guys, and we hope you are too, and will join us this year. I'm turning it over to Rebecca.
Right, so in the meantime, what we're asking everybody to do is, or encouraging everybody to do is, all of our support group attendees, our education attendees, people in the general public, we're asking everyone to get involved with the 2020 walks. Now, normally we'd have brochures and posters and everything out in the community, at your meetings, events, and things like that. But unfortunately, with the way COVID is, we don't have those public events any longer. But obviously, please use Allie and I as a resource. Leanne, Amelia, everybody at the association is full aware of what's going on with Walk this year. So please feel free to reach out to any of us. Use us as resources. You can also go to alz.org/walk for all the resources, for all of the, I know there was a quick question in the chat about the dates for all of the Colorado walks. All of those are listed on there as well. If anybody is into social media, there's a lot that you can do on your Facebook, on your Twitter account, on your Instagram account. So please feel free to reach out to not only our social media groups, but please feel free to use yours as well. And if you have any questions, please feel free to reach out to us anytime. With that, I'm going to turn it over to Leanne.
Thanks, Rebecca, and thanks, Allie. I want to start by saying thank you to all of our program volunteers who have been so quick to help in new ways. Today, we'll be highlighting a couple of examples. Steve Zimmerman wrote about his experience, and I'd love to read exactly what he had to say about volunteering with his wife, Barb. He said, "Barbara and I are extremely pleased to be volunteers for the Alzheimer's Association. We have been involved since 2013 and have found it very meaningful. We teach classes, go to classes, and enjoy both the volunteers and the very professional staff with whom we associate. I also co-chair a men's support group from which I learn more of the realities of living with loved ones with dementia. Converting to online classes has been a challenge, but our presentations have not been significantly different. At least we don't have to wear masks while presenting from home. And the general response also have not been inhibited by the online formats. In times of necessity, we feel it's important to continue the mission and trust that this too will pass. Thank you so much to Steve and Barb." Sylvia Waller is often out in the community talking with people who need association services but don't know where to start. And since we can't currently be face-to-face in the community, she has done an incredible job pivoting her efforts by having a virtual longest day fundraiser and making phone calls to past walk participants to help them get registered. Sylvia says, "It has been a little tougher to promote due to COVID, but I am posting various posts on Facebook and Instagram to keep Alzheimer's, the fight, and the cause in the spotlight so people don't forget about it during the pandemic. Sylvia, you're doing a great job spreading the word in whatever way you can. Thank you." And the third local volunteer we want to tell you about today is Sherry Chavez in Brush, Colorado, who volunteers with us as a support group facilitator, community educator, and is on the Walk to End Alzheimer's Greeley Committee, all while working at a care community. In her own words, she says, "I have been involved with Alzheimer's as a care partner, educator, but most of all, a learner since 1981. Being part of the Alzheimer's Association family has been rewarding for me. COVID-19 has been one of the most challenging times in my life, personally and professionally. However, navigating through virtual everything to give the support, presenting, meetings, etc. has been a plus. In our world where life as we knew it pretty much came to a halt, all the other illnesses that have been around didn't halt. This, of course, includes Alzheimer's. This on top of everything else, our communities still needed and wanted the support. Providing virtual support has been a blessing. We were still able to see faces, hear voices, and guide individuals to the right resources if necessary. Technology has been very beneficial, not only for me, but others, and we are able to offer the necessary resources to families and other care partners virtually. I will continue to support, learn, and offer my services to others, even in a time of COVID." Thank you so much, Sherry. And this is happening all across the country. Here are just a few outstanding examples. Carolyn Scott from Las Cruces, New Mexico 3 days a week, Carolyn visits residents at a local care facility using video conferencing that connects to iPad tablets that staff pass to residents in their rooms one by one. She has applied the same spirit of ingenuity to launching a virtual version of the Alzheimer's Association support group that she facilitates as a volunteer. As you can see here, Carolyn is also active with her local Walk to End Alzheimer's. As a practicing neurologist in her home country of Honduras, Claudia Amador got involved with the Illinois chapter when she relocated to the Chicago area. She runs a Spanish-speaking support group and became a community educator this past year because she's very passionate about Alzheimer's and dementia, especially reaching the Latinx community. While Claudia is unable to deliver programs in the community at the moment, she had a very positive attitude about shifting to a virtual platform. Christy Ruth is a nurse and one of Heart of America chapter's newest community educator volunteers. She began her volunteer work with us while she worked for a memory care home in the Kansas City area. During the COVID-19 crisis, Christy lost her job. She said, "I may have lost my job, but now I have even more time to dedicate to educating families about this disease." Christy's calling to help people was carried even further during the COVID-19 crisis. She signed up with the FEMA nurse team to help the crisis in New York City. And before she left to help in New York City, Christy was scheduled to deliver one of our virtual educations. She insisted to forge ahead and keep her Zoom practice time with our staff and deliver the education while on her day off in New York. She said, "Taking this time to prepare to deliver the education for those who need this back home is an honor, and I wouldn't miss it." She considered this opportunity a privilege as part of her downtime. And Christy has returned home to Kansas safely and continues to help deliver our virtual educations. And we are so proud to work with such a passionate and dedicated volunteer superhero. The Alzheimer's Association applauds all of our volunteers nationwide stepping up and leaning in right now at this critical time to assure our communities that they are not alone in this journey. We're deeply grateful, and we want you to realize that you're part of a huge movement of volunteers across the country that demonstrate through the power of many that our mission continues, even during a global pandemic. Now I'd like to introduce our Director of Programs, Tina Wells.
Hi, good morning, everybody. It's great to see there are 55 people on this call, and I recognize so many names. I really wish I could see you again in person. Someday, I'm confident. I wanted to start out, I hope you all know that the Alzheimer's Association really went out front early on in this COVID-19 situation. We wanted to make sure that we were advocating for the needs of our dear ones living in care communities, in our long-term care communities, and their family members. As you know, they're still very deeply and adversely affected by this pandemic. So the other thing I'm hoping is that all of you have gone to our website. Please jot down the web address here, the alz.org/COVID-19, because as you can see, we have created our home office such amazing resources at our fingertips, not only for families that are living at home and dealing with this, but also in our long-term care communities. What's also really cool is that this information, our COVID tips, have been introduced on national webinars and shared with our community partners like the International AME Church Health Commission, the National Hispanic Council on Aging, Medical Alert Foundation, and just recently on an AARP tele-town hall. And I'll give you a sneak peek. I think Colorado is going to be able to be involved in that AARP, the next AARP teletown hall, which I'm excited about that. So Because we've been able to get this information out nationally in these webinars, we're able to reach more people that may not have otherwise gotten this information for us. Next slide. Great. So the other thing, and you know I'm a strong proponent of the Alzheimer's Association. I'm so proud to work for them. We've taken a really strong stance on public awareness and advocacy aimed at improving our state and federal response to the COVID-19, particularly in long-term care settings. So we formed some policy recommendations you see on the slide that you can download them, and I encourage you to do that to see the details of those recommendations. But essentially, we are wanting to advocate and ensure that there's on-site testing capability available so to reduce the spread of COVID-19 in our long-term care communities. The other piece is that all cases of COVID-19 in nursing homes and assisted livings are being reported immediately and accurately. So our home office, our national organization, issued these recommendations based on, and they were informed by the CDC guidelines in order to protect who we know are the most vulnerable of our clients. So we're going to continue advocating for changes like this at the state and federal level, and we hope you'll stand behind us and advocate as well. Okay. This, there's a brief that was created. So on the right side of the slide, this will be available for everybody. We're going to send that out after the presentation today because it's super important. We have a commitment at the Alzheimer's Association to serve all communities. But as we've been continuing to monitor the effect of COVID-19, we're recognizing that health inequities among African American, Hispanic, and Native American communities have been openly exposed as a result of the pandemic. So this brief that we'll send you will be a great opportunity to learn more about those disproportionate, the impact of those health disparities. So we'll send that to you. We're also going to be privy and given the opportunity to have more upcoming webinars focused on health equity issues, because it's super important for all of us to be aware of that. In addition, inclusion is a core value of the Alzheimer's Association. I hope every single person on the call understands that about our organization. As we've been reminded recently, systemic racial and social injustices have permeated all aspects of society and are intertwined with the causes of health disparities for many in our communities. As an association, we must create a society in which people feel safe, cared for, and valued. All people. So we're going to continue our work to include all communities and advance health equity. Okay. I would like to take a minute. I want to make sure everybody writes down this website. Advocacy is critical at this time, and we're encouraging all of our program volunteers to learn about our advocacy efforts. Right now, there are 3 priorities with Congress. Number 1 is promoting Alzheimer's awareness to prevent Elder Abuse Act. And essentially what that is that we'll be asking that the Department of Justice require training materials, that they develop training materials to assist professionals that are supporting victims of abuse that are also living with Alzheimer's. So essentially it's ensuring that those interactions are really good and quality interactions with the vulnerable population. The second priority is the Improving Hope for Alzheimer's Act. And I know everybody on this call knows how important it is that our clinicians are educated about the care planning services that are available through Medicare. And then lastly, expand access to credit for nonprofits. Basically what that is establishing an exclusive fund for nonprofits, large health organizations, charity organizations, so that we can continue to do this good work and reach more people. So if anybody wants more details on our public policy efforts, and to join and become an advocate, which is super easy to do. All of us on staff have done it. It's just a click. allsimpact.org/volunteer, or you can text if you're into texting. It's super easy, and there's a pre-populated email, and it goes to your senator, and then you get an email from them. It's super easy. So has everybody been able to put down allsimpact.org/volunteer? That's probably good. Thanks, Leanne. This is another thing I'm super excited about, you guys. AAIC is the largest and most influential international meeting dedicated to advancing dementia science. So it convenes all of those gurus, all of those people that are prominent and at the forefront of trying to figure out a way, those new research discoveries. It was supposed to be in the Netherlands this year. How many of you were able to hop on a plane and go to the Netherlands? Obviously, for reasons we all know, it's been transitioned to a virtual event. And it's free. And it's open to all of you. So those of you that are interested in science and Alzheimer's research, go to this. Let's keep that up for a moment, Leanne, too, so people know how they can register. It's going to be a week long. It's going to be recorded as well, so you can attend sessions. Just an amazing, amazing opportunity for staff across the country and all of our volunteers. Okay. Great. So the question of the hour is, what's next for our virtual programs? And I know Amelia touched on this, and I want to drive it home and end our my portion of our time this morning. As you know, the safety of our staff and volunteers and our constituents will always be our primary concern, and particularly the vulnerable people that we serve. So if we were to meet in person and we had attend a support group and contract COVID-19 and then go home to their loved one who's living with dementia, who's at even higher risk, we just cannot, we cannot allow that to happen. So while you might not have had many cases in the areas where you live, the association nationwide is continuing to follow the CDC guidelines, as well as our state and local health departments for guidance. We're going to continue to take all reasonable precautions. Some of you may think it's pretty conservative. We are being extra cautious. Our offices are still closed. They're going to remain closed until we believe it's safe to open again. So until that time, all of our programs will continue to be offered virtually. And you heard from Amelia that there have been a lot of silver linings as a result of that. But I want to end, with a couple comments because due to the fragile nature of our constituents, there will be no in-person programs or meetings or events allowed or authorized, even if your community has reopened. These unauthorized programs or in-person events really pose a health and safety liability risk. So I appreciate your patience and understanding, your continued support, your help with us continuing to offer these virtual programs. Keep sending us questions. I'm happy to answer them. Your staff partner can answer them. We'll have time at the end of this program for a Q&A. We understand there's just so many conflicting opinions on this, but as a national organization, all of our offices will remain closed. There will be another document that we'll send out after after this presentation that reiterates all of these points. So thanks so much for your attention this morning, and I'm going to pass it back to Leanne, who's going to talk to us about some new, which is really cool, you guys, new volunteer opportunities while we're at home. So thanks much.
It is really cool. Thank you, Tina. So while our model of service delivery changed due to COVID, we've learned that many families like the ability to receive education and support at home. So we anticipate a continued virtual presence with programs even after we all can return to our communities. To support that, we're introducing some additional work from home volunteer roles, such as virtual community educator, and this role will exclusively offer programs virtually through Zoom or other platforms. Our virtual community representative, like the educator role, this volunteer will focus on virtual connections to spread awareness of the association's programs and connect people to help. So that's similar to what Sylvia Waller, who I talked about earlier, is doing using Facebook and other social media platforms. We also have program team support. We are recruiting for tech support volunteers who can assist the chapter with our virtual delivery. So this type of volunteer will help our educators, support group leaders, and representatives run the technology to support their programs. So this volunteer is experienced with Zoom or other platforms and can run the slides, monitor the chat, and moderate the call so that you can focus on the content. And support group mentor. This new volunteer role is for experienced volunteers who want to support other support group facilitators to grow and improve their groups. These volunteers can fill in for short-term absences in virtual groups. But more importantly, this role gets our volunteer support group leaders together to talk about what you need, support through difficult group conversations, and even make sure you're getting the resources you need. Kind of like an account manager, this mentor might serve several support groups at a time, so we can again make sure that our programs are as strong as they can be. So as volunteers delivering virtual programs, let's quickly talk about how best to teach via technology. Raise your computer. The most flattering angle for the camera is to capture your face from the same level or a little bit above it. So grab some books or a slim box and put your computer on top of it until the camera is right across from your face. Personally, mine is on top of old board games that I had that I don't use very much. So also imagine your audience. Try something that lots of actors learn. Imagine that your best friend is sitting inside your computer or inside the camera lens and talk to her. And this will help keep your programs lively, imagining a real person. Relax your face. If you're teaching online and unfamiliar with the software, you may be looking at your screen with a worried or worse, a panicked look on your face. And this will only make participants feel worried and anxious too. So practice with the software ahead of time, or assign someone else to be your technical director so they can deal with any glitches. And before you begin, intentionally keep your face relaxed, unknit your brow, and put a pleasant smile on your lips. And this will actually help you feel more relaxed too. Watch your background. What can people see behind you? Is it an unmade bed? Not so great. I am actually in a closet, and so all my staff and coworkers, they know this, that I'm in a little closet, but you can't see because of this very pleasant Alzheimer's Association background that you are able to download as a volunteer and use yourself if you so choose. We also have some that look like walk flowers in the background. So be sure to ask your staff partner about that option. Next, adjust your lighting. The light source should come from in front of you. Avoid backlighting, which can make you look like a scary silhouette. And last, second to last, dress the part. Even though participants can usually only see you from the shoulders up, wear something that looks great on you from the waist up. In fact, the better you dress from head to toe, the better your posture will be and the better you'll feel in general. And when you feel better, you're going to be a more relaxed and more confident presenter. And lastly, watch your eyes. When you're looking at a little black dot, the camera, at the top of your computer screen, your audience will feel like you're looking at them. And if you need to look elsewhere, like on your computer or on your actual desk to refer to your materials, that's fine. Just make sure that every so often you look at the camera. As long as you check in with your audience from time to time, they will experience good eye contact from you. Thank you for laughing, Amelia. You make me feel better. All right. I'm going to turn my camera back off so that we can focus on this part. So this is our Alzheimer's Association program volunteer community. How many of you have visited this online community where we have training, resources, and support? If you haven't, I recommend you work with your staff partner to log in for the first time and look around. This is a great place for our volunteers to gather, discuss a common topic, and support one another and learn more. We're going to be posting more education in this site based on what you need to perform your role with the chapter. And lastly, as a reminder, we ask that every volunteer sign the conflict of interest and confidentiality agreement each year. For the past couple months, I've been sending an email with a link that you can click to sign the forms electronically, and that way no one has to print or scan or physically sign it. If you feel like this is something you still need to do, please feel free to reach out to me directly. Otherwise, I'll be sending a reminder out very soon for those who we don't have a 2020 record. So thank you all so much for joining us at Colorado's Volunteer Pep Rally. I'd like to now open it up to questions, which you can type in the chat box to start with. And at the end, we might open it up for you to open your videos and to audibly ask the questions. But I'm going to ask Kelly Ostoff to let me know if we have any questions that have come in the chat so far. Any questions, Kelly? I don't think so. Does anyone want to come on screen and ask a question? Someone says, how does one obtain the ALZ background? Steve, what you can do is reach out to your staff partner and you can download them.
And Leanne, earlier there was a question about the dates for all of the walks here in the Colorado chapter.
So those dates have not changed, so you can find those online on our website. I might ask Allie or Rebecca to remind me what that website is, though.
That would be alz.org/walk.
Okay.
Leanne, I have a question.
Sure, go ahead, Catherine.
It's Catherine from one of the Denver support groups. I was talking to a caregiver who is intrigued by participating in a support group through Zoom or Blue Jeans. And she was just trying to puzzle through how that would feel given that she's in home providing 24/7 care for her mom. And so she asked me if the chat feature would be enabled for the support groups, because she felt like if she put her headphones on, her mom wouldn't be able to hear what was happening. But if she said a question out loud, her mom would hear it. And her mom gets rattled by any sort of conversation about dementia because her mom refuses to get a diagnosis. So, so that's my question. When I move over to Blue Jeans and then Zoom for the support group, will that chat feature be enabled?
Yeah, absolutely. So similar to right now, if someone wasn't comfortable coming on camera, you can absolutely type in that question and it will be read. And if any other staff members want to step in, please feel free.
I mean, I know how Zoom works with the chat feature, but I also know that organization can kind of lock that down. So I didn't know what the specific Alzheimer's Association setup was going to be for the support groups. So I would love to just confirm before I recommend that this gal joins, you know, that she would be able to participate in that way.
Sure.
Yeah, Catherine, that is such a clever solution, because that's been a topic for all of us in our support groups. So making sure that we even mention that, to say, well, where your head's at, we do say that, so that they aren't hearing, no one's hearing what's happening. And then that idea of using the chat room to write a specific question. I hadn't even thought of that. And
it was her idea, and yeah, I won't take credit. But when I looked at it from her vantage point, I thought, of course, you know, because I have had a few people participate by phone, and it has been a challenge.
This is Tina. I want to also add that when we transition over to Zoom, and we're shooting for August 1st for that, we will absolutely make sure that all of our volunteers, our support group facilitators and our community educators, any of our volunteers that will be conducting our programming by Zoom, we're going to give you guys some training. We're going to give you some tips. There are ways to conduct meetings to ensure that people feel comfortable. But I loved your comment as well, Catherine, and I think that is going to be a best practice. I like that. Thank you for sharing it.
I'll pass that along to my neighbor then. Thank you.
Thanks, Catherine. If anyone else has a question, please feel free to pop up or, go ahead.
Hi, Deborah. I'm Jennifer. I'm from Canyon City. I'm one of your facilitators. And Katie, who is my backup facilitator, she does not have a capability, there's a fly, a capability of doing computer stuff. So I don't know if maybe her and I can meet together and then still do Zoom. I'm not sure.
Yeah, because there'll always be a phone-in option too. So even if she's not having the experience of seeing who's in the room, she can still be in the room on the phone and just as engaged. We're actually gotten pretty good at that kind of too, just being really thoughtful of folks that are on a call, because that's true in a lot of places where they maybe just don't have even enough internet, let alone a technology to do that. So it is a nice part of that. So thanks, and so nice to meet you. I haven't met all of my people yet. So glad to know.
We meet tomorrow.
Okay.
So at 3.
I'll see you then.
All right, anything else?
This is Steve. I had a question about teaching classes with Zoom.
Sure.
Are we going to have the capability to play to everybody the videos that we normally use face-to-face?
Great question. Can someone else answer that? Because I'm not.
I think I can, Steve. I just want to assure everybody that the home office is moving from Blue Jeans to Zoom because it's easier. It has more functions, and those videos will work so much better. The home office recognizes that there were a lot of problems in delivering our education classes with those videos. So that was part of the reason for us going with the Enterprise Zoom account. So I'm confident, Steve, and we'll work with you to make sure that there's no hiccups.
Great, thank you.
Yeah, you bet.
Thanks, Steve. Anyone else?
And we have a comment for Tina Wells.
think I hear two people speaking.
Kelly, go ahead. I think you're speaking.
We had a question in the chat from Catherine White.
I think you're breaking up again, Kelly.
Help calls.
Oh, Kelly, I think you're breaking up.
Mentioned that Linda, I'll pass it to you and I'll let Tina
Yeah.
over the chat.
Thanks, Kelly. Go ahead, Linda.
I just had a comment for Tina. I'm thrilled to hear you're going to train us, because when you were speaking today about slides, I never could see slides. So we need training so that we can understand how to do this. So I'm also glad that you're going to send these things out, because I can look at them afterwards.
You know, we're all in the same boat. We all are, you know, I'm sure I had a furrowed brow or a frown, because it's just so weird to me. I see this little light and I see a slide that says questions and I'm talking to a screen. So, Linda, yes, we will make sure that everybody has the training they need. I understand it was piecemeal when we launched into this virtual setting back in March. We were just scrambling and just figuring out a way to hurry up and make sure we didn't miss a beat, right? We wanted to make sure that we were still meeting the needs of our families. So we have a little bit more time and we're going to get a training. I'd love to hear you. I wish I could see you, Linda. I miss you. You're awesome out there.
Thanks. I love the virtual because, at least in my meetings, you can tell the people that are there are so glad to get that help. So even though we have smaller meetings, the people that are there are getting help. So I'm grateful for that.
Yeah,
Thanks for what you do.
Oh, thank you,
And you know,
Linda.
can I just add too, Linda, you know, one of the things that we all did as staff when we pivoted was we all got in the room and we practiced. And I think that you can be sure that, and same with you, Steve, we will all get in the room and practice with you. Your staff partners, it's what we needed to do, and it's what we might need to do again when we transition, but that's why we're here and we're really happy to do that.
Hey, Leanne, it's Amelia. I see that Catherine asked a question about the helpline, which I mentioned has 500 to 600 calls typically in a month. And she asked, how has that grown or changed during COVID-19? It's been a wild ride for our helpline, honestly. We've been hearing it and having it monitored, you know, every week. And I will say, after everything shifted really in mid-March, we saw a really big decrease, which was interesting for us. So I think for a lot of people, they were sort of bringing things together, they weren't necessarily thinking about reaching out to us. And so what's really interesting is we have since then seen that as I mentioned, the calls have become much more complex. I think there's just general stress for people right now. And so I think a lot of people are needing to talk even beyond, you know, Alzheimer's and dementia. So the calls have become a little more complicated. And then also I think the interesting thing is in the past couple of months, we've seen those helpline calls start to increase. Mm-hmm. And they are now right back about to, Tina, you might even have a more updated piece of information, but they're right about back to where they were before. Anything else you want to add to that, Tina?
No, that's correct. And I would just add, you know, there had been some staff changes at our contact center. And so they're reevaluating and looking at the pattern of those calls. And they have brought back all of our helpline agents to handle all of these calls. But last I heard, we were back to pretty much our pre-COVID rate of calls. Amelia, could you answer Dennis's question, Martha and Dennis, about the MIM art auction?
Yes, I can. In fact, it's funny. I think JJ's on this call too, and we were just emailing about this topic. Many of you are really familiar with our Memories in the Making art program, which then leads to an auction in the Denver area, typically. And that was supposed to be held in June. Unfortunately, that we did postpone that, and we talked about doing Memories in the Making, doing an art auction virtually, because I've seen those. I actually have been on a couple things in other art auctions, but you know, after really careful thought, there are three main reasons we're not going to do that. But one of those is it, in the end, it actually it really doesn't have the return on investment that we need it to have. At the same time, the art is created in care communities primarily, and most of the care communities have put their Memories in the Making art program on hold. And so I think I saw that Lisa is on this call. She's the person who runs our art program, and for a lot of our care communities, they weren't able to meet in groups. They had to do their activities independently. A lot of the care staff are taking care of other things, and so we probably, the art production is not happening in the same way it used to. And so we will absolutely be looking at doing this next spring. We're looking right now, we have a great committee that's looking right now at spring and early summer dates. So we are absolutely moving forward, and we'll likely have the art that's held over from this year to use next year. We've got some amazing, it's gorgeous, gorgeous art. So good question. Thanks for asking that, Martha and Dennis.
All right, anyone else have a question they want to type in the chat or pop up on video and unmute themselves? Please feel free. Okay. I think that might be it then. So the next steps are you will be receiving an email from us with the recording of this, as well as the documents that Tina spoke about. Thank you all so much for coming. I know this was our first volunteer pep rally, but I hope that it's not going to be the last. Thank you all.
Thanks, everybody.
Thank you.
We appreciate
Thank you all.
you.
Take care.